This is Late Night Health, the radio and video program that cares about the most important part of your life. During this next little bit, we're going to discuss blood pressure with Dr. Greg Celaya. He's a functional medicine specialist. Hi, I'm Mark Alyn. Welcome to the program. We'd appreciate your comments. You can comment to us at drcelaya.com, drcelaya.com, or latenighthealth.com. That's latenighthealth.com. Blood pressure, the silent killer. Why is it so silent, Dr. Celaya?
Hey, good morning, Mark. Well, I mean, it's rare that it even gives you any symptoms. But think about this, Mark. You have 2/3 of Americans that have pre-high blood pressure, and 1 in 3 have high blood pressure. And you have to wonder why. Why are people having high blood pressure? And the reason is you have a problem. There's a problem with either liver, there's kidney, or arterial. There's damage that has happened to create problems. Let's say, for example, if you're looking at the arteries, the lumen is decreased in size, and you have to wonder why.
The lumen is the opening?
Yeah, the center of it.
Center of it. It's like a clogged drain.
Yeah, exactly. I mean, it's kind of like when you take your garden hose, and this analogy isn't 100% right, but you turn it up full blast and the pressure's pretty good. You turn it down lower and water barely comes out of the end. So you can understand pressure a little bit. That's really not a great analogy, but you can understand it.
Right. No, exactly. What about genetics? How does genetics fit in with blood pressure? I know that in my family, one side of the family had high blood pressure. And other people I know who have high blood pressure or pre-high blood pressure, again, they have a family history of high blood pressure or low blood pressure for that matter.
Yeah, well, there are genetic components, but we go back to genetics and epigenetics, and you don't have to necessarily realize all your genetic problems if you do the right things. So even though you may have a genetic history of high blood pressure, just like you might with diabetes and heart disease, it doesn't mean you're going to get it. It depends upon what you do.
And that's where epigenetics comes in. You can change your genetic predisposition.
Exactly. It's the programming, right? We were talking about computers beforehand, and the genetics are the hardware, and the epigenetics is the software.
Gotcha. How does diet take part in relating to blood pressure? I'll give you an example. I remember even as a kid, don't eat too much salt. It raises your blood pressure. I've talked to other experts who said there's no conclusive evidence that salt is the cause of high blood pressure, though it may raise it.
Yeah, well, while we're on salt, but salt's an interesting one because there has been research that showed that it does raise blood pressure, but very small unless you eat a lot. But we have a problem with low blood pressure just as well as high blood pressure. But one of the big things that we see is a high sugar intake, which can increase your insulin levels, which increases insulin resistance, which increases sodium, and then increases blood pressure, and then can also increase problems with arterial damage. So you can see where it can even come from. Sugar is a big one.
And eating too much fats or not? Because that's what we've been told since, the 60s, don't eat fat. You and I have discussed fat on this show before.
Yeah, fat, it depends on your fats. If you're eating healthy fats, it's not an issue. If you're eating a lot of, different type of fats, that the man-made fats, you can have a problem. And fructose can be a problem too, right? The high fructose corn syrups. It inhibits endothelial synthase, which basically works with nitric oxide to dilate arteries.
Well, dilate opens up. Is
Right.
that a good thing?
Right. So it may decrease nitric oxide, which becomes a problem when it comes to dilation of the arteries. So we can end up with blood pressure issues from high fructose corn syrup or a lot of fructose.
Can you feel blood pressure? I know we said that it's a silent killer, but you put your hand on your neck and you feel the pulse.
Well, if you don't feel the pulse, you have a problem.
Yeah, absolutely.
So I don't necessarily know anybody that can predict their blood pressure. Some people say they can, but that's what we have tests for. The problem is that some people basically say the validity of blood pressure testing is really not that good either, because it depends upon where you check it and how you check it,
It
right?
also changes, you wake up in the morning, it could be low. In the middle of the day when you're really stressed, it could be high.
Yeah, exactly. I mean, what happens when you exercise? Does your blood pressure go up to 400 over 200, like some people say? So if that's the case, is running at 160 over 90 going to kill you? I think it really depends more upon what damage you've already had to your arteries that may cause them to be a problem.
How do you know if you have arterial damage?
Well, it's a good one. I mean, we were talking the other day about calcium tests, and they can look at calcium because there's different ways to look at how the patency of your arteries are. So the carotid scan, as I mentioned to you yesterday, you were wondering if you should do it, and I said absolutely. Why wouldn't you?
Right, exactly. Yeah, I'm going to have a running, what do they call it? A running a stress test. And I've had these for years and years, and they just want to, it's just part of every couple of years you should have it done.
Absolutely. And it does make a difference, but you have to also look at other things. For example, you have potassium, which is a huge thing with blood pressure. It's opposite of sodium. You have the omega 3s. They're huge for keeping your blood thin and decreasing inflammation, right?
Right. Uh, they used to have, and I don't know if they do anymore, they used to have a salt substitute that was potassium chloride rather than sodium chloride. Does that work? Is that a better thing to season your food with or not?
Well, theoretically, but for me, I stay away from anything that's kind of not that God hasn't made. You've got magnesium, which is huge with decreasing blood pressure. It vasodilates, and it also helps with reducing free radicals. When you have adrenal stress, your body dumps magnesium, and you have problems. Calcium is another one, and arginine. You've heard of arginine before, right?
I think there's some over there on my shelf.
Oh, there you go. It's an amino acid, and it helps with
L-arginine, isn't it L-arginine?
yeah, and
Right.
it helps with blood pressure by working with nitric oxide.
What about uh, uh, things like cooked food? Certain ethnic foods have a lot of salt. Chinese foods, Mexican food, Jewish food are all high salt content foods. You have to dump those.
Well, I think it depends what your blood pressure is at that time. It's like, for example, we were talking about low blood pressure, and low blood pressure is just as big an issue as high blood pressure because you're not getting blood to certain areas. Blood's not perfusing to those more distal areas, like, for example, the brain. Right. And so we want to make sure blood pressure is appropriate. And I suggest with patients, if they're dealing with low blood pressure, to take a good natural, perhaps a sea salt or Himalayan salt that has other minerals in it as well to increase blood pressure. So, for example, with myself, I have low blood pressure. I'm eating the daylights out of salt. But if you have high blood pressure, I don't suggest that. I suggest you reduce salt.
I like pickled foods. I like real pickled foods, naturally pickled foods, not pickled foods with added vinegar. I like them because of the taste. I also think that they have health benefits because of the probiotic nature. My grandmother used to drink the juice of pickle jars because of the probiotic. She did it. We didn't call it probiotics then, but she felt it was a healthy thing to do. Are pickled foods and probiotic foods, are they good for us?
Well, there's two different questions, but absolutely. And like I said, the research shows that salt would have to be taken in big quantities to actually really make a big difference in blood pressure. But if you have high blood pressure, you may want to reduce those foods.
Got it. Um, what is the easiest way to test your blood pressure? I mean, obviously, going to your doctor, your healthcare provider is one. There are a number of very inexpensive blood pressure monitoring kits available on the internet. I have one someplace around here, but they changed the adapter at the end, so I have to figure that one out. My point is, should everybody check their blood pressure on a regular basis?
Yeah, in our country, yeah, the answer is yes. In other countries, that may be a little bit different because they have a little different concept on it. But you should check your blood pressure, and it's simple enough to check. If you don't have a blood pressure cuff or can't afford one, you go to a normal drugstore, and they're everywhere. Um, but back to supplements,
Right.
Vitamin D and K2 are huge at reducing blood pressure, and what they do is they keep calcium in suspension. And so one of the big problems is that we have arterial damage due to calcium deposition in these arteries.
And what about what we used to call, and I think it's still called, chelation therapies, which reduces the arterial wall damage or the buildup of that plaque, the fat plaque on the walls? Can we get rid of that some way?
Well, chelation is very, very interesting, and it's something I do quite frequently with patients. But you have to make sure you know exactly what you're doing because chelation can be great, but on the other hand, it can be a real problem if it's done incorrectly. So, but there's other things like, for example, CoQ10 is phenomenal for decreasing inflammation, and garlic. I know you love garlic, and
I do.
there's something in there called
Yeah.
allicin that makes a big difference.
A friend of mine is actually with his lunch. I don't know how anybody could be around him, but he eats one or two raw cloves of garlic a day rather than a supplement. And I just find that that might kill my stomach. I love the taste.
Yeah, well, everybody's got their own thing. I think it's a great thing if you can pull that one off. The problem is you have to be around people. But there's other things. For example, weight loss, better sleep, your stress, because when you have stress, you have cortisol, adrenaline, which increases blood pressure. The lack of exercise, meditation can make a difference. Alcohol can increase blood pressure. Same with caffeine, smoking. And fasting and the ketogenic diet does make a difference at reducing blood pressure as well.
Oh, and the ketogenic diet is real.
It's a fat-based diet and reduced carbs. The carbs are a real big problem because what happens is when you reduce carbs, you decrease the sodium content and you also decrease water, so that decreases blood pressure.
Uh, I know you're not a proponent in general of pharmaceuticals, but a lot of people are on diuretics, which means that they drink a lot of water and they pee it out, which lowers blood pressure. Is there a way of doing that naturally without without a diuretic?
Yeah, and doing the diuretics, that's just treating the symptom. But all the things that we just mentioned make a difference. Now, don't get me wrong. If you have high blood pressure and you just found it out, I think that you have no choice but to easily go on medication while you take care of these issues. And I work with other doctors all the time to help reduce people's blood pressure so they can get off the medication. But if it's very high, you need to get on medication quickly because what we do will take some time. And you don't want to increase the risk of coronary issues or stroke because of that. So it's not a bad thing. It's just one of those things that you shouldn't be on for a long period of time. But you have to remember that you have it because you have an issue. There's either probably liver, there could be kidney, and there could be arterial damage.
And there are tests for all three of those things?
Well, yes, there is. So, but it's kind of hard sometimes to get to the root cause of why it's there. Sometimes you just have to treat some of the things. So, like for example, the vitamin D and the K2 are huge at reducing blood pressure. It makes a big difference, and it's great for everything else as well.
It also helps with depression, vitamin D.
Absolutely, it helps with so many things, and I think we've talked about vitamin D before, but we can spend a week just on vitamin D and its benefits.
Absolutely. Well, in conclusion, people should have their blood pressure checked and regularly. One of my doctors has told me to check it at different times of the day because blood pressure changes.
Well, absolutely, it changes, and half of the time you get the white coat syndrome where you go into the doctor's office and you're so nervous to begin with, your blood pressure
Boom.
increases. And next thing you know, they give you medication because they've seen your blood pressure increased. But when you're home under normal circumstances, it doesn't happen. So you need to be an advocate as well for your own health, especially blood pressure, because You don't want to be on the medication if you don't have to, but if you do have issues and you want to take care of it naturally, there's a lot of ways to deal with it.
And in taking magnesium, should you take magnesium by itself or with, it's usually packaged with potassium, isn't it?
It could be many different ways. I suggest people take about 1,000 milligrams a day, depending upon what their scenario is.
Gotcha.
But you can get it in nuts, seeds, spinach, beets, greens, that kind of.
So you don't have to actually take a pill.
The bottom line is if your diet's really good, you may not need to, but it really depends. And there's other ways to determine magnesium and its issues.
Correct. And again, with a blood test?
Not necessarily with blood tests, with symptomology.
Okay.
The thing is with a lot of these minerals, like for example, calcium is a real poor test because it's stored in bone. And your body usually, if everything's going right, pulls from bone to make sure your blood levels are correct. So testing blood levels really doesn't give you much information.
Gotcha. Dr. Celaya, thank you for joining us today. If you have a question or would like a free consultation with Dr. Celaya, 15 minutes free, visit him at drcelaya.com, 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 or you can reach out to us at latenighthealth.com. We'll put you in touch with Dr. Celaya. We'll talk again next week, Doctor.
You betcha. Have a good day, everybody.
You too. Bye-bye.